Hello everyone, myself Dr. Shama Sharief, working as a retina consultant in Eye Foundation, Madurai. Today we will be talking about diabetic retinopathy. What is diabetic retinopathy? Whenever the patient is diagnosed with diabetes mellitus, there are problems that they can have in the retina. Retina is the nerve of the eye. So what are the problems that they can have? They can have swelling, bleeding that can be seen and diagnosed by a retina specialist. So what does the patient has to do? Whenever you are diagnosed with diabetes mellitus, you have to get your retina checkup done. Why is it important to get it done? Because whenever there is a diabetic retinopathy in the early stages, the patients are unaware of these changes that are happening in the eye. They will come to know only when the problem is serious. That is, whenever they come into a treatment stages like diabetic maculopathy, diabetic macular edema, or vitreous hemorrhage or tractional retinal detachment. So how can a doctor help you? So whenever you go for the screening and you are diagnosed with diabetic retinopathy, the doctor can treat you in the early stage and the doctor can prevent the blindness. So what are the treatment options that are there for you? The treatment options are lasers, intravitreal injections that are done in the early stages, but in the later stages when the patient comes with the complaint of floaters, diminution of vision, which is like blurring, patient is not able to see the distance vision or the near visions, or if the patient is seeing something floating in front of the eye. So what are the treatment then? The treatments will be the vitrectomy, that is the retina surgery has to be done in those stages. Now coming to what are the injections. So whenever the patient is diagnosed with diabetic macular edema, that is the swelling that happens in your retina, the patient is given intravitreal injections. The injections that are given into the eye, these reduce the macular edema and can improve the vision. So what does the patient has to do in order to prevent this blindness? Is this blindness preventable? Yes, diabetic blindness is preventable. And how a patient can prevent this? By early screening and regular follow-up as advised by your retina specialist. Thank you.